Sarah enters the doctor's office and sits down. Dr. Asadi, good morning, Sarah. How can I help you today?
Good morning, doctor. I've been having some pain in my lower abdomen, and it's been getting worse over the past few days. I'm really worried about it. Dr. Asadi, I'm sorry to hear that you're in pain. Can you describe the pain for me? Is it constant or does it come and go? It's a constant dull ache, but sometimes it gets sharp, especially when I move around or during intercourse. I've also noticed some unusual discharge. Dr. Asadi, I see. Have you experienced any other symptoms like fever, nausea, or pain during urination? Yes, I've had a low-grade fever for a couple of days and some nausea. No pain during urination though. Dr. Asadi, thank you for sharing that. Based on your symptoms, I suspect you might have a pelvic inflammatory disease. It's an infection of the female reproductive organs. We'll need to do a pelvic exam and possibly some lab tests to confirm the diagnosis. Does that sound okay? Yes, that's fine. I just want to know what's wrong and get it treated. Dr. Asadi? Of course. Let's start with the pelvic exam and then we'll take it from there.
Dr. Asadi performs the pelvic exam. Dr. Asadi, during the exam, I noticed some tenderness in your lower abdomen and cervix, which supports the possibility of PID. We'll need to do a few tests to confirm. I'll take some swabs to check for sexually transmitted infections like chlamydia and gonorrhea, which are common causes of PID.
Okay, how long will it take to get the results? Dr. Asadi, the results should be back in a couple of days. In the meantime, I'll prescribe antibiotics to start treating the infection right away. It's important to begin treatment as soon as possible to prevent any complications.
Sarah returns to the doctor's office a few days later for a follow-up appointment. Dr. Asadi, hi Sarah, good to see you again. I have your test results here. They confirm that you have a pelvic inflammatory disease and the infection is due to chlamydia.
I'll make sure to finish the medication. What should I do about my partner? Dr. Asadi, it's important for your partner to get tested and treated as well. I'll provide you with information on where they can get tested. In the meantime, it's best to avoid sexual intercourse until both of you have completed treatment. Thank you for letting me know. I've been taking the antibiotics you prescribed. Will that be enough to treat the infection? Dr. Asadi? Yes, the antibiotics should effectively treat the infection. It's crucial to finish the entire course of antibiotics, even if you start feeling better before they're finished. We might also need to treat your sexual partner to prevent reinfection.
Sarah returns for her final follow-up appointment after completing the antibiotic course. Dr. Asadi, hi Sarah, how are you feeling after completing the antibiotics?
Much better, doctor. The pain has significantly decreased and the discharge has stopped. Dr. Asadi, that's excellent news. It sounds like the antibiotics have worked. We'll do a quick checkup today to ensure everything is healing properly.
Dr. Asadi performs a follow-up pelvic exam. Dr. Asadi, everything looks good, Sarah. Just remember to practice safe sex to reduce the risk of future infections and make sure to get regular checkups.
I will, doctor. Thank you so much for your help. Dr. Asadi, you're welcome, Sarah. Take care and don't hesitate to reach out if you have any more questions or concerns.
Sarah leaves the doctor's office feeling relieved and reassured.